Hi, it's Lindsay with Mom Mia Lactation. Today on Pearls for the Girls, we're going to talk about the engorgement phase of lactation. So, the engorgement phase happens typically between day 3 and 4 postpartum and day 9 postpartum. And the reason being is moms have a milk the earliest milk is called colostrum. It is low in volume, highly nutrient dense, difficult to pull, and it is the perfect food for your baby for the first couple days of life until your milk transitions to thinner, more mature milk. And that transition itself is called lactogenesis 2. And so lactogenesis 2 typically occurs for most moms between day 3 and 4 postpartum. However, the window that we lactation consultants are privy to, and I want to just spout to the world, is that the window of normal lactogenesis 2 can be up to day 9. And the reason that there's so much variability is there's so much variability in each mother's story. So their delivery story, what they look like as far as like their endocrine realities and concerns. So if there's any gestational diabetes or thyroid issues or any other host of endocrine issues, that can also delay lactogenesis 2. So whenever it is that you go through lactogenesis 2, you will experience something called the engorgement phase. So the engorgement phase is when every gland in your breast will fill with milk. Typically in this phase, mom's breast size increases like 2 to 3 fold. It's a little bit overwhelming. And it can be hard for kids to attach. So they've worked really hard. You both have worked really hard working toward learning how to latch together within the first couple days of life. And then once that engorgement phase hits, all of a sudden your breasts are a different size. Sometimes the fluid can fill all the way to the nipple tip and like make the nipple disappear. And then all of a sudden baby's trying to like attach to a bowling ball and everyone's frustrated and crying. So there's a trick. It's called reverse pressure. So if you find that you're one of those moms where you're like, hey, where'd my nipples go? There's a trick. It's called reverse pressure. You make a little flower with your fingertips, put your nipple right in the middle, and press deeply, gently, but deeply, directly back. And then hold there for like 30 to 45 seconds. Doing this allows you to displace fluid from the nipple tip and evert, if you have everted nipples, evert your nipple. If you don't have everted nipples, no problem. No problem at all. There will be more videos for you later. There is no perfect nipple to breastfeed a kid. It's called breastfeeding for a reason. It's not nipple feeding. So anyway, the engorgement phase can help displace some of the fluid from around the areola, around the nipple tip, and allow baby to attach deeper. So that's one trick. And then if you find that you're just really edematous and uncomfortable, you can lay on your back. You can apply heat packs, lay on your back, and then massage toward your axilla. So there's actually a lot of lymphatic tissue here, and you can help drain some of the fluid passively the other direction. Important key for the engorgement phase is to feed your baby as much as your baby cues and try not to stimulate extra. The reason I say try is there's a large school of thought that like you should not pump. If you're not pumping and feeding your kid, you should not pump until week 4 of life. I find that a touch too simplistic. So one thing I would like to encourage you as a mom is when people say never or always, pause for a second and be like, but where's the gray? Because there's always gray, right? There's always gray. So one thing that is an absolute is breastfeeding should never hurt. And so included in that phrase is the engorgement phase. The engorgement phase is uncomfortable. It feels really full all the time. But it can get to the point where you're so full, it hurts. It just hurts, okay? And so you can pump off some pressure to comfort. And then if your baby is not attaching, you can pump strategically as well. And so there's more information in the Mama Mia lactation course about like kind of how to strategize doing that. But for the most part, try not to pump if you can, but also do not tolerate any pain so you can pump off pressure. So put baby on as much as they cue. Try not to stimulate extra if you can. After 48 to 72 hours of the engorgement phase, typically your breasts will again feel soft in between feeds. It's not that your milk has gone away, it's that your brain has learned your baby's volume. And when baby attaches, then your letdown will happen and that appropriate volume for the baby will drop. It's really amazing. Anyway, that's engorgement phase. And there's a lot more detail. There's a ton more information, lots more physiology about it in the lactation course videos, but that's the quick and dirty. And don't forget the reverse pressure. It's a game changer. It is an absolute game changer. Anyway, all my best to you. You are exactly who your baby needs. Thank you so much for watching, and I hope you enjoy these videos.